Congratulations on the birth of your baby. Breastfeeding is so important. Why? There are so many reasons. Your milk is not only food for your baby, but it also contains ingredients key to the health and growth of your baby that cannot be found in formula. Your milk has live cells that engulf germs to prevent illness. It has growth factors that help your baby's digestive system mature. It also contains components that help activate your baby's immune system. We are only now beginning to understand the many roles your milk plays in your baby's lifelong health and development. Not only is breastfeeding important for your baby's health, but it is also important for your health. According to the U.S. Surgeon General, the risk of breast and ovarian cancers, type 2 diabetes, heart disease, and many other health problems are higher for women who have never breastfed. The longer you breastfeed, the less likely you are to suffer from these and many other illnesses. The World Health Organization and the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months. After 6 months, they recommend continued breastfeeding along with solid foods for a minimum of 1 to 2 years. While better health is a great reason to breastfeed your baby, there are so many more benefits. Breastfeeding is calming and comforting to your baby and helps strengthen the relationship between mom and baby. The reasons to breastfeed are endless, and Spectra Baby USA is here for you with products, tools, information, and support to help you meet your goals. We know how much breastfeeding matters, and we are there for you, Mom. Introducing the latest in breast pump technology, the Spectra S2 and S1 hospital-grade double electric breast pumps, boasting every innovation possible to make life easier for you, including powerful suction, double pumping, massage mode to encourage speedy letdown, ability to adjust both suction, strength, and cycle speed, nightlight and timer, and much more. This pump is absolutely quiet and is the most portable and stylish hospital-grade pump around. The Spectra S1, S2 hospital-grade breast pumps are perfect for daily use and for moms with preemies, multiple babies, low milk supply, latch-on difficulties, working moms, and hospitalized infants. They were made to initiate, increase, and maintain a milk supply over a long period of time. For such a powerful hospital-grade breast pump, it is lightweight, weighing in at about 4 pounds, so it is portable too. Both pumps can be powered by an AC adapter, and the S1 comes with an inbuilt rechargeable battery that allows you to pump for 3 hours on a single full charge. The M1 Advanced Portable Electric Breast Pump comes with a really small but energetic motor, a double collection kit, letdown mode, inbuilt rechargeable battery, and more. This pump is great for the working mom or anyone wanting to pump on the go. It uses the same technology as its big sister, the Spectra S2 and S1, in a small, pretty, and compact pump. Weighing in at under a pound, this pump is jam-packed with a powerful, strong motor, which will give you plenty of oomph for double-sided pumping. Each Spectra Baby USA breast pump comes complete with a premium double collection system. It keeps the breast pump completely dry and hygienic. Mold and bacteria cannot grow in the tubing or pump motor. A backflow protector keeps the air from getting into contact with your milk while pumping. With this barrier, you don't have to clean the narrow tubing. This simplifies pump care and helps provide protection. Before using it for the first time, boil the parts in the system for 5 minutes to sanitize them. This includes all parts of the collection kit except the tubing. Let these parts air dry. Wash your hands well with soap and water. First, insert the backflow protector into the back of the breast shield and then attach the tubing to the back side of the protector. Hold the white valve by the thick ends, not the flat edge, and gently attach it firmly onto the underside of the breast shield. The valve is vital for proper suction and should always be handled with care. Next, screw the collection bottle into place. And finally, push the tubing onto the port on the front of the breast pump. For double pumping with the S2 or S1, remove the cover on the extra port and attach your second kit in the same fashion as your first one. If you single pump and want extra suction, you can cover the port and pump with one kit. For M1 double pumping, attach each collection kit tubing to both sides of the little adapter. Then connect the short tube to the bottom of the adapter. You can then attach the other end of the short tube to the port on the M1 breast pump. When your collection kit is assembled, you are ready to use your Spectra S2, S1, or M1 breast pump. Before starting the pump, make sure that your nipples are centered in the tunnel of the breast shields. Hold them firmly but gently and make sure there is a tight seal around your breast. Start the S2, S1 pump on the lowest suction setting in the massage mode by pressing the power button first and then the massage button. It should say 70 in the cycle setting. Turn the suction up or down with the arrow buttons. This is called the massage mode. You can continue in this mode until you see the milk begin to flow into the bottles. After your milk begins to flow, you can press the massage button once again to start the expression phase. This phase is longer, slower sucking, just like a baby nursing. You can increase or decrease the suction and cycle settings to your comfort level in this mode. You can toggle back and forth from massage and expression modes to get multiple letdowns and to empty your breasts faster. Flange or breast shield fit is important for comfort and milk flow. What determines breast flange size and your fit is the width of the flange opening. You should see space between the flange and your nipple as it moves freely in the tunnel during pumping. If the tunnel is too small, your nipple may rub on the sides of the tunnel or move very little. If the flange is too large, too much of the breast may be drawn in and it may be hard to get a good air seal. For a better fit, we have optional extra large breast shields for larger nipples and reducing inserts, also known as massagers, to make the flange size smaller. If you have small nipples and the flange in your kit is too large, you can add our massage inserts to improve your comfort and milk flow. If your nipples are too large for the flanges that came with your pump, extra large flanges are available. When your milk begins to flow, this is known as a letdown or milk ejection reflex. This natural reflex pushes the milk out of the breast and is the most important part of successful pumping. During each breastfeeding, most moms have multiple letdowns, even if they don't feel them. When your milk flows faster, you can use your pump controls to follow your flow. To do this, use the cycle buttons to find the setting for fastest milk flow. When your milk release ends and your milk flow slows, try pressing the massage button to help trigger the next milk release faster. Most mothers express more milk in less time by using the massage mode to trigger milk flow and the expression mode to drain the breasts. Repeating the massage then expression modes several times is what we call dual phase pumping, which mimics a baby's natural sucking pattern at the breast. But these suggestions are just a starting point. Always use the pump settings that work best for you. In addition to using Spectra Baby USA's custom controls, triggering a milk release might be faster if you massage the breast or apply a warm compress before pumping. As you pump, tilt the collection kit downward slightly so your milk flows into the bottle. Relax and imagine your baby nursing at your breast. Dual pumping takes much less time, increases prolactin levels, and in many cases will yield the most milk. With dual pumping, allow 10 to 15 minutes per session. If you prefer to single pump, switch breasts every 5 to 7 minutes and allow about 20 to 30 minutes total per session. When you finish pumping, turn off the breast pump. Then, remove the flanges from your breast. Break the suction by inserting a finger between the flange and your breast. When the suction is broken, remove the flange. Finally, unscrew the bottles and screw the locking caps into place. Follow the milk storage guidelines you are given by your lactation consultant. After each use, clean the breast pump and kit. To clean the pump, simply wipe the casing with a soft, damp cloth. All parts of the collection kit that come in contact with your milk should be rinsed in cool water. Then, they should be cleaned well in warm, soapy water. The tubing will not usually need to be washed. The backflow protector protects it from getting into contact with your milk. The white valves should only be washed by hand and rinsed well. Be careful with the white valves. They should be washed and rinsed very gently. Do not use harsh soaps or abrasives. After rinsing, all parts should be air dried. Here are some tips to help you with pumping, milk production, and maintaining your milk supply while away from your baby regularly. Many moms are concerned with how much milk they should expect from each pumping session. Here are some of the factors that will affect the amount of milk that you pump during your pumping session. One factor that affects milk supply is the length of time it has been since your last pumping or feeding session. If your baby is exclusively breastfed and you are pumping a half hour or an hour after a morning feeding, expect to pump about half of a normal feeding. If you are exclusively pumping for a missed feeding, you can expect to pump a full feeding. Time of the day can also affect the amount of milk that you pump. Most moms pump more milk in the morning than in the evening. This is because prolactin levels are at their highest in the morning. How much practice you have with your pump can also make a huge difference. It can take your body a week or two to adjust to your new pump. How you are feeling on a given day can also affect your milk supply. When you are relaxed, you will be able to pump more milk than when you are stressed or nervous. Taking deep breaths during pumping can help you relax. You may wonder how much milk your baby is taking during a feeding. It's hard to tell since breasts don't have markers. During the first month of your baby's life, milk supply varies greatly. When your milk comes in after about the 3rd to 7th day, babies take in an average of 30 to 60 milliliters or 1 to 2 ounces of milk per feeding. It goes up to about 60 to 90 milliliters or 2 to 3 ounces per feeding during your baby's 2nd to 3rd week of life. From about 1 month to about 6 months, a baby's growth slows. For this reason, feeding volumes stay relatively stable, averaging about 3 to 5 ounces or 90 to 150 milliliters of milk per feeding. So how does milk production work? It's quite simple. The more often and the more fully your milk is drained from your breasts, the more milk your breasts will produce. And the longer your milk is left in your breasts and the fewer times you pump or breastfeed, the less milk your breasts will produce. Drained breasts make more milk, and full breasts make less milk. So in order to keep your milk production up, pump and breastfeed until your breasts are drained. If you are working all day and your baby is under 6 months old, it is recommended that you pump every 3 to 4 hours. As stated before, gentle breast massage before or during pumping sessions can really help to increase supply too. Some moms find that it boosts their breast milk amount right away. Ask one of our lactation consultants or a breastfeeding expert in your area about other ways to increase and maintain supply. Designed to be used in the hospital, at home, or at work, Spectra Baby USA breast pumps are there for you, Mom. Thank you for watching.